Hello everyone, in this season we are going to study hepatic diseases. This section is about primary hepatic carcinoma. Primary hepatic carcinoma or hepatic carcinoma is one of the common malignant tumor in China. In China, its death rate ranks the second among the death rates of all kinds of tumors. The age of hepatic carcinoma patients is generally 40 to 50, and this disease is more common in men than the women. For now, it is considered the occurrence of hepatic carcinomas is related to such factors as liver cirrhosis, viral hepatitis, chemical carcinogenic substances like aflatoxin, etc., water and soil. In terms of pathomorphology, hepatic carcinomas are divided into three types: node type, massive type, and diffuse type. The present classification is tumors with diameter less than 2 cm fall under microhepatic carcinoma with diameters of more than 2 cm and less than 5 cm. Small hepatic carcinoma with diameter 10 cm, large hepatic carcinoma, and with diameter 10 cm, massive hepatic carcinoma. In terms of histopathology, it is also divided into three types: hepatic cell type, bile duct cell type, and mixed type, with hepatic cellular carcinomas accounting for about 95%. The cells of hepatic carcinoma can spread in the liver through the portal vein system very easily, and the extrahepatic metastasis through blood circulation mostly occurs in lungs and also in bones and the brain. Hepatic carcinomas are rarely metastasized through lymph but can be metastasized to lymph nodes of porta hepatis, as well as peripancreatic, retroperitoneal, para-aortic, and supraclavicular lymph nodes. In case of middle and advanced stages, tumor can directly invade adjacent organs and spectrum transversum, or lead to implantation, metastasis in the abdomen cavity. In terms of clinical manifestations, hepatic carcinomas generally lack of typical symptoms at the early stage, and upon the occurrence of symptoms and signs, it means the disease has entered the middle or advanced stage. The common clinical manifestation is hepatalgia, which is generally a persistent, dull pain, stabbing pain, or swelling pain caused by the increased tension of the liver capsule as a result of the fast growth of tumor. When the cancer on the top of the right half of the liver affects the septum transversum, the pain may radiate to the right shoulder and the back. In the case of intraperitoneal hemorrhage due to necrosis and rupture of a tumor, the manifestations would a sudden acute pain in the right upper quadrant, signs of peritoneal irritation, etc., like an acute abdominal diseases. As there is no symptom of other parts of the body or the digestive tract, it is likely to be ignored in most cases. The main manifestations include weakness, loss of weight, appetite decrease, abdominal distension, etc. Some patients may be accompanied by such symptoms as nausea, emesis, paresis, abdominal pain, etc. In the advanced stage, anemia, jaundice, ascites, and cachexia may also occur. During palpation, we may discover the liver grows progressively. It's hard in texture, has an irregular brim, and uneven on the surface, and present nodes or lumps of different sizes. In the case of metastasis to organs such as lungs, bones, brain, the corresponding symptoms will occur. If a hepatic carcinoma shows typical symptoms, the diagnosis will not be difficult, but the early stage generally has long passed. Therefore, all patients over the mid-age, especially those with the history of hepatic disease, shall take a detailed examination in time. In the case of cryptogenic hepatologia, loss of weight or progressive liver growth, hematological examination with ultrasonic, etc., the alpha fetoprotein AFP determination are help for early diagnosis and even can detect asymptomatic micro or small hepatic carcinomas, absence of signs. If a patient has a history of hepatic diseases such as hepatitis B or C, the serum AFS is less than 400 ml and increases continuously in gestation. Active hepatic diseases and gonad embryonal tumors can be ruled out. A hepatic carcinoma can be considered in the diagnosis. In immunological examination, ultrasonography is a non-invasive examination method of a good diagnostic value at present and can be used for a general survey of susceptible people. The ultrasonography can display the location, quantity, size, and form of tumors as well as the presence of cancer embolus in the hepatic vein or the portal vein, and its diagnostic occurrence rate can be as high as about 90%. The CT scan has a higher resolution and its diagnostic occurrence rate is higher than 90%. The magnetic resonance image MRI has a similar diagnostic value as the CT scan and can provide the reconstruction imaging for the hepatic vein, the portal vein, the inferior caval vein, and the biliary tract, and display the cancer embolus in these cavities. The diagnosis occurrence of the selective hepatic arteriography is about 95%, and tumors with the diameters of about 0.5 centimeter can be discovered. As this is a traumatic examination, it is considered only when necessary. The ultrasound guided fine needle aspiration USFNA cytological diagnosis can make a definition diagnosis of carcinoma cells, but it is occasionally gives rise to false negative tumor rupture, hemorrhage in punctured channels, and spreading of carcinoma cells along the punctured channel. It is not recommended for clinical fracture. A differential diagnosis shall be carried out for primary hepatic carcinoma versus liver cirrhosis, secondary hepatic carcinoma, liver abscess, and tumors in organs adjacent to the liver, such as the right kidney, hepatic flexure of colon, stomach, pancreas, etc. In respect of treatment and early diagnosis and in early adoption of comprehensive therapies, mainly the surgical resection, are the key to improve the long-term treatment effect of hepatic carcinomas. Surgical resection includes partial hepatectomy and liver transplantation.